Do robots actually make knee replacement better? Welcome back to Joint Ventures, an OSC original podcast. I'm Dr. Boyd Haynes, sports medicine physician and orthopedic surgeon at the Orthopedic and Spine Center in Newport News, Virginia. Today we're diving into one of the most debated topics in adult reconstruction, robotic-assisted total knee arthroplasty. Robotic knee replacement has rapidly moved from emerging technology to a major force in modern orthopedic surgery. Hospitals are investing heavily in robotic systems, surgeons are increasingly incorporating them into practice, and patients are now specifically requesting robotic surgery by name. But despite all the excitement, one important question remains. Are robotic systems truly improving outcomes, or are they simply adding technology and cost to an already highly successful operation? Today, we'll review the current evidence and discuss what robotic systems appear to do well, where the controversy remains, and what questions are still unanswered. Conventional total knee replacement already performs extremely well. Modern implants have excellent long-term survivorship, and knee replacement remains one of the most successful procedures in medicine. Yet despite that success, nearly 15% of patients remain dissatisfied after surgery. That dissatisfaction created an opportunity. Could technology improve consistency? Could surgery become more personalized? Could accurate execution create a better functioning knee? Robotic systems entered the space with several promises: improved preoperative planning, real-time intraoperative feedback, greater precision in bone resection, dynamic balancing capabilities, fewer alignment outliers, and perhaps most importantly, more reproducible surgery. If there's one category where robotic-assisted knee replacement clearly demonstrates an advantage, it's implant positioning accuracy. Across multiple randomized trials and meta-analysis, robotic systems consistently produce fewer alignment outliers, improved hip, knee, ankle alignment, and more consistent component positioning. Robotics allows surgeons to work with three-dimensional planning and millimeter-level precision, often keeping alignment within approximately 3 degrees of the intended target. Put simply, robotics reduces variability. But this is where the conversation becomes more complicated. Historically, surgeons pursued neutral mechanical alignment. Today, alignment philosophy continues evolving toward more individualized concepts like kinematic alignment, restricted kinematic alignment, and constitutional varus. So while robotic systems may hit targets more accurately, an increasingly important question emerges. Are we absolutely certain we're aiming at the right target? When it comes to patient function and satisfaction, the evidence becomes much less clear. Some studies do show measurable benefits with robotics, including improved range of motion, lower pain scores, less blood loss, and lower dissatisfaction rates. One large series involving about 1,400 patients found dissatisfaction drop from approximately 9% to about 3%. However, other high-level reviews have found little or no clinical meaningful improvement in patient-reported outcomes despite the improved precision. And that distinction matters. Statistical significance and clinical significance are not always the same thing. Patients may show measurable improvements on paper that are difficult to appreciate in everyday life. Overall, the literature paints an interesting picture. Implant positioning clearly favors robotics. Range of motion may show a small robotic advantage. Complication rates in some large database studies also appear to favor robotics. But conventional surgery still maintains advantages in operative time and overall cost. Robotic procedures typically add between 10 to 30 minutes to surgery and can increase cost significantly depending on the system and analysis being used. One surprising finding in recent research is how short the learning curve appears to be. Most surgeons achieve procedural efficiency after roughly 7 to 11 cases, and perhaps even more importantly, the alignment benefits appear almost immediately. Large national database studies have also become increasingly interesting. Some analysis involving hundreds of thousands of patients have demonstrated lower rates of pulmonary embolus, DVT, transfusion, pneumonia, respiratory complications, renal failure, and even mortality in robotic cohorts. While these studies certainly have limitations, the consistency of these findings across multiple data sets has gained attention within the orthopedic community. Still, the biggest challenge facing robotic knee replacement may ultimately be the cost. Robotic systems require enormous capital investment, maintenance contracts, software, disposable instrumentation, staff training, and workflow redesign. Some studies estimate direct per case cost approaching nearly $12,000 compared to about $8,700 for conventional surgery. Supporters argue lower complication rates and potentially fewer revision surgeries may offset these costs long term, but much of that argument remains theoretical at this point. And that brings us to the central issue. Patients do not care whether an implant was placed within 1 degree of planned target. Patients care about pain relief, function, recovery, satisfaction, and avoiding future surgery. Despite the clear radiographic advantages of robotics, we still do not know whether increased precision ultimately translates into better long-term implant survivorship or substantially improved patient outcomes. The discussion also extends beyond robotics itself. Surgical approach and intraoperative techniques continue evolving as surgeons look for ways to improve recovery. One example is the subvastus approach, which preserves the quadriceps muscle and tendon by working underneath the vastus medialis muscle instead of splitting through the quadriceps muscle or tendon as in traditional approaches. Research suggests this may provide better early quadriceps strength, less pain, and improved early range of motion. However, those benefits appear mostly confined to the early recovery period, and long-term outcomes become similar by 6 to 12 months from surgery. Tourniquet use is another evolving area of debate. Traditionally considered standard during total knee replacement, tourniquets provide a bloodless surgical field and may improve visualization and cementation. But studies increasingly show trade-offs. While tourniquets may reduce intraoperative blood loss, they also associated with more postoperative thigh pain, more swelling, delayed mobility, and quadriceps dysfunction. Many enhanced recovery protocols now advocate for more limited or selective tourniquet use to prioritize pain control and early recovery. So where does all of this leave us? Robotic-assisted total knee arthroplasty clearly offers advantages in precision and reproducibility. Muscle and tendon-sparing approaches and selective tourniquet avoidance may improve aspects of early recovery, but the biggest unanswered question remains whether any of these refinements truly improve what matters most: implant longevity, fewer revisions, better function, and greater satisfaction over time. For now, the evidence continues to suggest that surgical judgment, patient selection, and execution may still matter more than any individual technology. Perhaps robotic knee replacement is not a revolution, perhaps it's an evolution. Thanks for listening to Joint Ventures, an OSC original podcast. If you enjoyed this episode, be sure to subscribe, leave a review, and share it with someone who may be considering knee replacement surgery. We'll see you next time.
At Orthopedic and Spine Center, we're dedicated to providing the highest quality treatment using the most advanced technology available. Our fellowship-trained spine and interventional pain management physicians specialize in diagnosing painful conditions and offer minimally invasive interventions to complex spine surgeries. Our pain psychologist helps patients understand and reduce stress from chronic pain conditions. Our experienced physicians get you back to doing what you love. Call today for an appointment. Experience excellence at Orthopedic and Spine Center.